Today I'm going to talk about vitamin D supplements and prevention of cancer and cardiovascular disease. Definition: vitamins are chemicals that are needed by your body for good health. They are vital for everyone and ensure that your body works well, is able to fight illness and heal well. Vitamin D is important for good overall health and strong, healthy bones. It's also an important factor in making sure your muscles, heart, lungs, and brain work well, and that your body can fight infection.
Facts say that the number of cancer patients is growing every single day, and modern medicine still hasn't found or confirmed a cure for this fatal disease. Namely, more than 1.5 million new patients have been diagnosed with cancer in the US only in 2016, and we are still hopeless in curing it. Nevertheless, it seems that newest studies can alter our theories about its cause. Almost 70% children and 75% adults in the US lack vitamin D, which is an extremely disturbing fact. Vitamin D inhibits the appearance of almost all illnesses, including diabetes, heart disease, and cancer. To be more specific, our entire well-being is influenced by the sufficient amounts of vitamin D in our body. Dr. Cedric Garland, in his study, found that the deficiency of this vitamin is directly related to certain cancer types, in most cases, breast cancer. Moreover, this scientist believes that the risk of this type of cancer can be decreased by half in the case of sufficient amounts of vitamin D in the organism. Several other studies have also indicated that the lack of this vitamin in the body can lead to cancer. Another research conducted by Joan Lapp and Robert Heaney in 2007 involved a group of menopausal women who took vitamin D supplements in order to raise their levels to 40 mg/ml. The results were astonishing. The risk of developing all kinds of cancer was reduced by 77% in 4 years. Therefore, to be more specific, even though this research has not provided enough evidence that this vitamin can cure or prevent cancer, it clearly shows that these two are directly related. The reason for this is the fact that numerous functions in our body are influenced by this vitamin. Vitamin D largely influences the function of the autoimmune and cardiovascular system, the healthy bone growth, and the body's absorption of calcium. Nevertheless, the issue that arises concerning the relation between vitamin D and cancer is that in most cases, people do not know that they lack vitamin D. A blood test can precisely show the levels of vitamin D in the body, but you can also read the symptoms that your body sends in this case. When your body has insufficient amounts of vitamin D, you will experience muscle weakness, cognitive impairment, particularly in older adults, painful bones, severe asthma, especially in children, chronic pain, excessive sweating. If it is not a result of a physical activity or high body temperature, excessive sweating is a sign of reduced vitamin D levels. Depression. According to research, vitamin D deficiency raises the risk of depression for 11 times. This is due to the reduces release of serotonin, or the hormone of happiness, which influences our mood. Regarding the newest discoveries by studies who examined the link between the proper body function and vitamin D, the daily allowance of this vitamin has been changed. Namely, the needed daily amount of this vitamin in all people aged 170 is 600 U, and 1000 U in the case of infants. The intake of the needed doses of vitamin D is extremely important, primarily for your healthy bones, muscles, and in order to prevent cancer. Hence, you need to consume foods rich in it, including tuna, mushrooms, fatty fish, milk, yogurt, orange juice, and the like. Moreover, you need to spend some time in the sun, as the sun exposure is extremely beneficial in the case of vitamin D deficiency. Furthermore, you can also take it in the form or oral supplements, as vitamin D3. Note that in that way, You need to take them for several months, as they will need some time to raise the vitamin D levels in the body.
Applications in medicine. The dietary supplementation with fish oil and vitamin D in this trial did not result in a lower incidence of invasive cancer or a pre-specified combination of major cardiovascular events than that with placebo. Compelling observational data have long existed that the consumption of fish is associated with protection from cardiovascular disease.
We all know vitamin D helps us maintain healthy teeth, healthy bones, but new research out of the UK indicates it may have another very important health benefit to your heart. Dr. Devi, still with us here, these researchers involved in this study said this was stunning. What did they find?
Well, they found that people who had heart failure, so where the heart is having a difficult time pumping blood to the rest of the body, that they actually had significant improvements with vitamin D supplementation. So if you think about it, the heart actually, it doesn't pump everything that's in it, but it's sort of a reservoir. So it fills with blood that's coming from the lungs and from the rest of the body, and then it pumps it out to the rest of the body. So it should be able to get about 50 to 70% of that blood out there. Now, these people with heart failure, they were actually pumping much less, like about 25% of the blood. So they had a lot of different symptoms. When they got vitamin D, that number went up to about 35%. So that's a significant increase. And we don't see a lot of changes like that with some of the medications that we have. It's very hard to get the heart to function more efficiently. So this vitamin D supplementation is kind of a miracle for those patients, but we don't know for sure if this would happen for everybody or if it's 100% due to the vitamin D because it was a small study.
Where are we perhaps in expanding that study and perhaps one day seeing vitamin D just be another thing we are all reaching for?
Well, so there are two factors. I mean, first, they probably want to do the same study but with a larger number of patients, right? So these are called pilot studies where you look to see if there might be an effect, and then you do a larger study to see if this actually holds true in more patients. So that's sort of where we are with the research. But in terms of vitamin D being a regular thing for people, now, most people in our country actually have low vitamin D levels because we don't get much sunlight. We're always indoors, and vitamin D it's produced through sunlight. Now, there's supplementation, so if someone finds out that their bones are weak, they might get told to take calcium and vitamin D. So there's not that many dangers with taking vitamin D, but, we don't want to just tell people to take all kinds of supplements if they might not need them.
Still, when we hear experts such as yourself with the who to funk it quality to their answers, I may be reaching for the vitamins again.
Yeah, I mean, I think for most of us, because we work indoors a lot, it's not bad to kind of take vitamin D periodically just to make sure that your levels go up.
Doc, we appreciate the time today.
Thanks.
Largely on the basis of that one trial and supporting preclinical data, the American Heart Association issued a recommendation regarding largely on the basis of the one trial and supporting preclinical data, the American Heart Association issued a recommendation regarding the use of N3 fatty acids for the secondary prevention of coronary heart disease. Cons. Not unlikely, the result regarding marine N3 fatty acids. There has been a host of observational data suggesting that lower levels of vitamin D are associated with a higher risk of cancer.
issue applied in Ecuador. The vitamin D assessment study was a 3-year randomized placebo-controlled trial in New Zealand that involved 5,110 persons who received supplementation with high-dose vitamin D monthly. The risk of cancer of any type was 30% lower with the active interventions, although the confidence intervals include 1.0 and the result was not considered to be statistically significant. Conclusion: supplementation with vitamin D did not result in a lower incidence of invasive cancer or cardiovascular events than placebo.